Every 40 seconds, someone in this country is prescribed a medication that could quietly begin stealing their memory. By the time this video ends, hundreds more prescriptions will have been written, and for a portion of those people, the slow fog that follows will never be traced back to where it truly began. It won't be blamed on the pill. It will be blamed on age. I'm Dr. Mike. After years of sitting across from patients and watching this same story repeat itself, I've learned something that most people are never told at the pharmacy counter. A person can be sharp, funny, fully themselves for 70 years, and then within a single year begin to slip. They forget names. They miss appointments, they get lost on a road they've driven 1,000 times, and everyone around them nods and says the same thing. They're just getting older. But sometimes it isn't age at all. Sometimes it's a bottle sitting on the bathroom shelf that a doctor prescribed and a pharmacy filled, a medication nobody thought to question. Here is what the newer research keeps confirming. Certain ordinary, everyday medications can pull your memory and your ability to learn down hard inside a single year, and most of the people taking them have absolutely no idea it's happening to them. Today I'm going to walk you through the 9 medications most closely tied to rapid memory loss in older adults. I'm going to count them down, starting with the ones that get quietly overlooked, and ending with the one I personally consider the most destructive of them all. Watch closely for number 3, because it's handed to millions of people for something that sounds completely harmless, and it may be quietly affecting the memory centers of the brain without a single obvious warning sign. Before we begin, do something for me. Tell me in the comments how old you are and which medications you take every single day. I genuinely read them, and the age and situation of this audience shapes what I choose to cover in future videos. Now let's start at number 9, and don't let its low position on the list fool you, because this one is sitting in almost every medicine cabinet in America right now. Number 9 is diphenhydramine. You almost certainly know it by its drugstore name, Benadryl. It's the little pink pill people reach for to fall asleep, to calm an allergy, or to take the edge off a cold at night. It costs just a few dollars. It sits out on an open shelf, and most people assume that because you don't need a prescription for it, it must be gentle and harmless. Inside your brain, it's doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That's a long word for a simple idea. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and to stay alert through the day. As we age, the brain naturally makes less of it and leans harder on every bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than it does on a 30-year-old one. The part that takes the hit is the hippocampus, the small seahorse-shaped structure where new memories are formed before they get filed away for good. In my practice, I've watched patients take a nightly antihistamine for years and slowly lose their edge, never once connecting that mental fog to the pink pill sitting by their bed. The research connects it plainly. A paper published in a journal of geriatric cognitive health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. That's more than half again the normal risk, coming from something most of us treat like candy. Here's what to do. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that don't cross into the brain the way Benadryl does and are far safer for the long haul. Never stop a medication on your own, always bring it to your doctor, but stop assuming that over-the-counter automatically means safe for your memory. That's number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The big names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach, and they get handed out for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back, so it feels like the drug is the only thing holding the line. Here's the part almost nobody hears at the pharmacy counter. Your stomach actually needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough for long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's when the real cause is a nutrient your medication has been blocking all along. A large study in a neurology journal examined more than 73,000 people aged 75 and older. Regular proton pump inhibitor users had a 44% higher risk of dementia than people who did not take them. And the trouble may run deeper than nutrients, because these drugs have also been linked in some research to changes in the sticky proteins associated with Alzheimer's disease. So here's the move. If you take one of these every single day, that's the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your thinking. Simple lifestyle changes and certain soothing natural compounds can ease symptoms with no cost to the brain at all. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Ditropan. It's given to seniors who deal with that sudden, urgent need to get to the bathroom, the kind of overactive bladder that can reshape a whole day and rob a person of confidence. The relief is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the very same memory chemical that Benadryl blocks. And this one slips across into the brain very easily and parks itself right where memories are made. That makes it one of the more dangerous drugs on this entire list for an older adult, especially when it's taken month after month, year after year, without anyone stepping back to look at the bigger picture. A study published in a major medical journal looked at people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was around 49% higher, close to 1 in 2. And here's what troubles me most as a physician. Almost none of them were ever warned. They were simply told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation halfway through. And everyone around them nods and says, "Well, you're getting older." It's rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you've noticed your memory slipping, please take that seriously, because you do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and don't block acetylcholine at all. For most older adults, they provide similar control with far less risk to thinking. Bring it up at your next visit. Number 6 might be the most surprising one on this list, because it's one of the most prescribed drugs on the entire planet. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the world, especially after the age of 60. And they do an important job lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and this is absolutely not a blanket case against them. What follows is simply the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve so that signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it genuinely needs. The statins that tend to cause the most trouble are the ones that cross easily into brain tissue. A study published in an aging neuroscience journal found that adults over 70 who had been on statins for more than 3 years had a measurably higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline tended to be. Some patients describe frightening blanks, a familiar name suddenly gone, a conversation they just finished somehow erased, a route they'd driven for 20 years suddenly unfamiliar. The important thing to understand is that not every statin affects the brain the same way. Pravastatin and rosuvastatin don't cross into brain tissue as readily and are generally considered safer choices when it comes to preserving cognitive function. So if you've been on a statin for years and you're noticing fog, forgetfulness, or confusion creeping in, that's a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly stop a medication that may genuinely be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause. If this is helping you connect the dots, take 1 second and tap that like button. It genuinely helps this information reach more seniors and families who need to hear it. And while you're down there, tell me how many prescriptions you're taking right now. I read every single comment. All right, back to the countdown. Number 5. Number 5 is the Benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like an absolute rescue. The panic eases. The racing thoughts slow down. Sleep finally comes after weeks of none. But over time, the picture begins to change quietly. A study published in a British medical journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had roughly a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appeared to be even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain itself. What these medications do is create a slow chemical sedation of the entire brain. Learning becomes slower, mental flexibility decreases. Many people describe a sense of emotional flatness, as if they're moving through a fog and no longer feel entirely like themselves. And the cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. So here's the rule, and it truly matters. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. And there are specialized forms of talk therapy designed specifically for insomnia and anxiety that can restore calm without the cognitive cost. Now let's move to number 4. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this entire list. Number 4 is Amitriptyline, sold as Elavil. It's an older antidepressant that is still widely prescribed today for nerve pain, sleep difficulties, and even migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do everything at once. But beneath the surface, it's one of the most powerful anticholinergic drugs still in common use. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store new memories. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. A large study published in an internal medicine journal followed more than 3,400 adults aged 65 and older, those with the highest cumulative exposure to anticholinergic drugs such as amitriptyline, over a 10-year period had around a 54% greater risk of developing dementia. And almost none of them were ever told the medication could do that. They were given it for sleep or for pain, then gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was part of getting older. It doesn't even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes significant and hard to ignore. If you or someone you love takes amitriptyline, that's a conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood, newer antidepressants such as sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for, because it's prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Paxil. It's one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many of the older psychiatric medications. But here's the detail that's rarely discussed anywhere. Paroxetine is the one SRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram, because it affects the very same acetylcholine system that nearly every other medication on this list has been disrupting. A large review published in a psychiatry journal examined older adults taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were noticeably more likely to show early signs of cognitive impairment than those using other antidepressants. There's a painful irony in that finding. The medication is prescribed to help stabilize the mind, and yet over time it may erode the very clarity it was intended to protect. The solution here is straightforward. In older adults, paroxetine is generally a medication worth avoiding when good alternatives are available. A respected geriatric society has placed it on a formal list of medications considered potentially inappropriate for seniors, and paroxetine appears there for precisely these reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram, which are gentler and don't carry the same cognitive concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside these changes. Number 2 is prescribed so quietly that many people taking it don't even realize what type of medication it truly is. Number 2 is antipsychotic medication, and this one concerns me deeply, because many of the individuals taking these drugs never knowingly agreed to take an antipsychotic at all. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, they're often prescribed off-label to older adults for sleep problems, mild restlessness, or agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now frequently used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy caregivers to manage. The cost can be substantial. A study published in a longevity journal followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were significantly more likely to experience worsening cognitive decline within a year, even when they had no history of dementia before treatment began. These medications can also increase the risk of stroke, sudden cardiac events, and the profound sedation that contributes to falls and hospitalizations. They work in part by suppressing dopamine, a chemical involved not only in mood regulation, but also in focus, planning, and memory. Reduce dopamine enough, and the brain becomes slower and less responsive. That's why some individuals taking these medications can appear dull, emotionally flat, or almost absent, while their families grieve the gradual disappearance of someone who is still physically present in the room. If you or a loved one is taking one of these medications, the first step is to ask the prescribing physician a direct question. Why was this medication started, and is it truly necessary, or is it being used primarily for convenience? Many behavioral symptoms can often be improved without medication at all, through consistent daily routines, reduced noise and overstimulation, treatment of hidden pain, and better management of sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration helps reduce harm. Far too often, families are never informed about what these medications can do to the brain. They watch a decline they believe is simply aging, when the true cause may be chemical all along. Now we arrive at number 1. Number 1 is not a single medication at all, and it may be the biggest hidden driver behind almost every story I've discussed today. Number 1 is anticholinergic polypharmacy. It's the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults everywhere. You were probably expecting one final villain, one single worst pill to end on. The reality is more subtle and frankly more common. The greatest danger often comes from the slow accumulation of multiple anticholinergic medications taken together, while nobody ever calculates the total burden on the brain. Polypharmacy simply means taking many medications simultaneously. Anticholinergic burden refers to the combined effect of all of those medications blocking the same memory-related chemical at the very same time. Imagine a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each medication may produce only a small and barely noticeable effect. Together, however, those effects compound, and the burden on the brain rises rapidly. A study published in an aging journal tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had roughly double the risk of dementia within 10 years, and the overwhelming majority of them had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. When acetylcholine is blocked from several directions simultaneously, the brain doesn't simply slow down. Neurons can begin to weaken from underuse. Connections may shrink, and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. Here's the hopeful part, and it's the entire reason I made this video for you. Medication-induced cognitive decline is often reversible when it's identified early enough. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than most people ever realize, but only when the source of the harm is actually removed. The solution doesn't require a miracle, it requires a careful medication review. Sit down with your doctor or your pharmacist and review every single prescription medication, every over-the-counter product, and every supplement you take. Add up the total anticholinergic burden. Simple scoring tools exist to help identify that risk clearly. Once the problematic medications are identified, unnecessary drugs can be reduced or discontinued under medical supervision. Safer alternatives can be introduced, and the brain can be given a genuine opportunity to recover. This may be the single most preventable threat to the aging brain on this entire list, and that is exactly why it holds the #1 position. Now, I want to hear from you directly. Of these 9 medications, which ones are currently sitting in your medicine cabinet right now? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Tell me in the comments below, and tell me that you'll ask for a medication review this week. Your answer might be the very thing that helps the next person who reads it and recognizes their own story in your words. And before you go, there's one more place your body hides its warnings. Your medicine cabinet is one place, your hands are another. Your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system, sometimes years before other symptoms ever appear. Most people never learn what to look for. That's the topic of my next video. I'll show you the 4 nail signs worth checking tonight before you go to bed. I'm Dr. Mike. Stay sharp, take care of that brain of yours, and I will see you in the next one.